And we now talk to the OCTA Research Group. Joining us live via Zoom is Dr. Guido. Good morning, Professor, and thank you once again for joining us. Now, over the past few days, we've seen the positivity rate increasing in several areas and breaching the recommended 5% threshold by the World Health Organization. What are the current numbers, Professor? What areas registered high positivity rate, and how alarming are these numbers?
Yeah, hi, Ria, good morning. So in NCR, as of July 9, which would be Friday, the positivity rate has actually reached 10.9%. So it's a little higher than 10%, although 5% is the recommended level. 10% is still, a reasonable positivity rate. So if it reaches more than 10%, it's a little concerning. And Aklan, for example, has a 26.9% positivity rate. Antique, Batangas, Capiz, Cavite, Iloilo, Isabela, Laguna, Nueva Ecija, Pampanga, Rizal, Tarlac are some provinces with more than 10% positivity rate. So the reason we're looking more closely at positivity rate than just the number of cases is that we noticed that at similar points in the previous waves, when the positivity rate reached a certain similar level, the volume of testing that we have currently, for example, in the NCR, is about half of what we were testing during the January surge, and it was about 1/3 of what we were testing compared to last year. So what it means that with a similar positivity rate of about 11% in Metro Manila, the wave would have been around 4,000 cases per day nationwide, or about 6,000 cases per day nationwide last year.
All right. With this being the case, Professor, is it going to change the country's risk category?
Well, at this time, we've also recalibrated the risk metrics. So for the regions to reach a higher risk category, the hospitalization would have to reach a higher level. And at this time, I believe the NCR has a 27% healthcare utilization, which is still low, especially compared to the previous waves. So the fact that not a lot of people are getting admitted to hospitals means that the NCR and other regions will probably be at the low risk classification for the meantime. In the NCR, it's probably not going to see a higher risk classification, at least according to the metrics that are being used currently. Although there are regions which are close to that 50%, we're still monitoring that, and they may be put at a higher risk classification.
Right, Professor, as of yesterday, we have over 13,000 active cases. Does that figure, have we breached your expectation or cases count projections over the previous week?
Well, Ria, it's actually still according to our projections. At least the number of case counts is still within the mini surge that we projected initially. That it's around, in fact, it's more or less it's more or less going along with the projections that we're now at around 2,000 cases per day and almost 800, which is almost 1,000 cases per day in Metro Manila. The numbers will still continue to increase a little bit before we expect that the peak will occur sometime during this month.
Right. So what exactly are your projections for this week? You said the peak will come second to third week of July, so we're pretty much almost there. Are you expecting cases to still go higher amid the presence of these Omicron subvariants and looking at the figures we have right now?
Yes, definitely, Ria. We expect that cases will increase. It could increase to more than 1,000 cases per day in Metro Manila. Maybe it could go up as high as 2,000 cases per day in Metro Manila alone. And in the whole country, we expect it to increase to about 3,000, possibly by next week. Maybe it could go up to as high as 4,000 cases per day. And hopefully, cases will start decreasing after then. If the wave is prolonged, then of course we might see cases go higher than what we're projecting, but hopefully it won't get prolonged.
All right, Professor, thank you so much for that. That was Professor Guido David from OCTA Research.